Hello everybody, welcome back to my channel. Today we're going to be taking a look at gait analysis. So there's a few different things that you want to think about when you're looking at somebody's gait or their ability to walk and the quality of motion that they have in their walk. You're looking at their range of motion, you're looking at how smooth their motion is, and the deviations that may be present from the normal gait motion. So for a background, if you want to find out more about gait, you can always look at Ranchos Los Amigos gait scale. They go through and break down individual muscles that are being used in certain parts, the distribution between stance time and swing time, or the amount of time that your feet are on the ground and in the air. And they go through a lot of detail about that. It's very good, very important information, and sets a really good foundation for what to be looking for in normal gait. The most important thing about gait analysis is knowing what normal gait is, so that way you can tell what's not normal. By knowing the solid ground level, we can look for deviations from that and be able to tell what may cause those. So in just a minute here, we're going to head out front, we're going to go for a walk, and we're going to look at a patient with pretty normal gait and do a little bit of analysis from that. Now, normally in gait analysis, you want to look from the front, from the back, and from both sides to get a holistic image of how the person's moving and the deviations that they may have. Some that you could see from the back may not be visible from the side, like ankle inversion or eversion, changes like that. But they're a lot easier to see when you can see the calcaneal tendon or just the lay of the calcaneus underneath the talus and the rest of the ankle joint. So you really want to make sure you get a couple different angles. You want to see, preferably, especially in the beginning when you're starting out with gait analysis, you want to have the opportunity to look at multiple steps and focus on your systematic approach, whether top down or ankles up. But you really want to have the time that you need to get a full, thorough analysis. With practice, it may just take a couple of steps, but it's always better to start out more conservatively going into something like this. And so that's going to cover it for the introduction. Let's get out there and see what's going on. So when we look at the gait of our patient in front of us, there's a couple things we can see. You want to start either, of course, from the ankles up or the head down, as long as you're systematic with it, like I talked about earlier. It's going to be the most important thing. But starting from the ankles, you can see, if you look very carefully, a little bit of eversion of her left ankle, a little bit more on the left than the right. Her legs track pretty straight forward under her hips, but you see a lot of hip rotation laterally, and you see a bit of side-to-side motion, kind of side bending in the pelvis. When we go a little bit higher up, we see good trunk rotation happening, along with a good contralateral arm swing to the leg movement. Her shoulders move reciprocally with the arm swing, of course, and her head stays pretty centered. Overall, this is a very good normal gait, but of course, when you have small changes, you can have exaggerated changes throughout the rest of the system as a result from that. Now, normally, in analyzing somebody's gait, you want to make sure you do it from the front, the back, the side, and the opposite side, of course, so you get a good, thorough impression. But for the sake of this video, we're just going to go ahead and stick with a posterior view.